Welcome back. It's great to be with you again. I'm Jim LaPierre. This is Sober Now. Today's topic is a heavy one. I'm going to be talking about the sharp increase in overdose rates. As always, really welcome your comments, your questions. We're streaming on a lot of different platforms today. If you haven't yet been over, please check out Sober Now's Facebook page. We'd love to have you just give that a quick like. You'll get notifications for future live streams and other content that we're creating. So let's jump into it, but let me also say that if you have questions or you're struggling in an area that doesn't relate to this topic, please, by all means, message in. We'd love to be of service to you and talk about what's going on in your life. So, I'm going to talk just a little bit about the problem, and then as my friends in recovery say, we're going to move out of the problem and into the solution pretty quickly. We broke all records in 2020 for both deaths that are a product of overdose, deaths that are related to drug use, deaths that are related to alcohol use. It's disturbing to me that we continue to differentiate alcohol from all other drugs, but that is what we've done. So in 2020, more than 93,000 people died directly from overdose, according to the Center for Disease Control. That is a 29.4% increase from the 72,151 deaths that we saw in 2019. Again, only relating to overdose deaths, only from drugs, not from alcohol. How do we even begin to address this? The numbers are discouraging, and what's even worse is that there's a high potential that 2021 is going to surpass the numbers that were record-breaking in 2020. The impact of our current pandemic, undeniable, restricted access to services, availability of services. It's driven up the need for services in mental health and in substance use disorder. It's very difficult to obtain treatment right now, and I've been saying to folks for about a year and a half now, if you're even thinking that you might need some outside help, please reach out for that now. Don't wait. The wait lists are pretty staggering. So I think we all know by now that the war on drugs is dead. I'm tired of even acknowledging it, but it was our approach for somewhere between 40 and 50 years, dating all the way back to the Nixon administration. The shift in law enforcement that I've seen in the course of my career has been one of the most profound changes in terms of addiction recovery and treatment for substance use disorder. I have a great appreciation for the police officers that I get to work with, for the parole officers I get to work with. We've certainly come to terms with the idea that we are not going to arrest our way out of addiction. I really want to focus in today's stream on things that unite us. Different pathways to recovery. Frankly, I support all of them. To be even more frank, I support anything that helps people like me not die. And I recognize that there are some aspects of addiction recovery that, for whatever reason, are controversial, whether that's harm reduction or medicated assisted treatment or safe injection sites or any number of other things. And frankly, I don't want to talk about those. I don't want to talk about the things that divide us. I want to talk about what unites us and what it is that each of us can do to improve things in our community. If you're opposed to something, that's cool. I'll respect that. But whatever it is that you do support, can we throw a little bit more energy, a little bit more time, a little bit more resources into it? Because there's no reason to believe that this is going to do anything other than get worse if we're not treating addiction as though it is a community responsibility to support addiction recovery, to support education and prevention, to prevent things, to support preventative measures and education that help people like me not get addicted in the first place. So I have a huge appreciation for my friends and family who say, I recover loudly so that others don't have to die silently. Addiction may be more prominent and deadly than ever, but addiction recovery is more visible than ever. And I think that's an easy way to support recovery efforts, is to simply share your experience, strength, and hope as publicly as you're comfortable doing, And even if you're not a person who identifies as being in active addiction or being in recovery from substance use disorder, you can still help to educate others, to advocate for others. You can still highlight things that are positive things that are happening in your community and underscoring community responses to what is clearly a health epidemic. There's a number of things that I think we lose sight of in the midst of the opioid epidemic that we've been in for a number of years. One of the biggest things that we tend to overlook is that deaths directly attributable to alcohol have been increasing every year for over 2 decades now. The CDC says that we lose more than 95,000 deaths in the United States every year for things that are directly attributable to alcohol. The minor health impacts that it has perhaps on exponentially more of us aren't included in that figure. According to the World Health Organization, over 3 million deaths globally are directly attributable to excessive alcohol use. And so we have multiple epidemics in the midst of a pandemic, in the midst of a whole lot of systemic responses that have fallen short of meeting needs. So, again, I want to get into the solutions, and some of these are maybe a little bit lofty, but I think all of them are practical. And for folks who, again, don't identify as being a person in recovery or a person with substance use disorder, one of the greatest things you can do is be an ally to people in recovery. My Q Plus friends have done a wonderful job over the past couple of decades of really popularizing the idea of what it is to be an ally. Very simply, it means that you don't identify, but you do accept and respect and support and advocate for those who do. The concept of being a recovery ally is gaining. It is becoming more popular, and it still has a long way to go. And there are countless ways in which you can be a recovery ally, and I'm going to touch on a few of those. I think the most important thing you can do is educate yourself about the disease of substance use disorder. We really can't hold space any longer for discussion of, is it really a disease? Yes, it absolutely is. It's a brain disease, and it's recognized by every major medical organization, psychiatric organization, and psychological association throughout the world that it is in fact a brain disease. No credible organization or professional questions that. And ideally, we would treat the disease of substance use disorder in the same way that we regard any other disease, and what types of resources and responses should be forthcoming. Learn about what you can do in your local community. There's always opportunities. There's always folks that are stakeholders. At this point, all of us should recognize that every single person is affected by substance use disorder. It's only a matter of how directly. So work within your family, your community, and any system that you're currently a part of. Work within your professional roles. I get to be an ally as an employer. My experience is that giving people a second chance or an opportunity to shine in a career, they are incredibly hardworking. They're more dedicated and loyal than most employees. We have a mythology about people who have experienced addiction as being lazy or not hardworking. My experience is actually the exact opposite. I get to be an ally as a landlord. I understand that criminal convictions that are incurred when a person is in active substance use disorder are not an indicator of who that person is today. I'm far less interested in a person's past than I am in their present and what their plans are for their future. I get to be an ally as a volunteer. I volunteer time locally based on things that I have the ability to do professionally. I get to volunteer at my local recovery center, and I get to serve on committees and boards of directors that support missions that benefit people in recovery. And I get to advocate for change at every level, at the municipal level, the state level, and the federal level, because there has never been a time when we've even scratched the surface of what's needed in terms of resources and funding and laws that do not discriminate. Mostly, I get to show up for people I love. And I underscore this whenever I get to talk to people in power, because there's an old adage about how there's only two types of people in the world, us and them. People who are in active addiction and people who are in recovery from addiction are people that I very much relate to. I don't see any distinction between myself and those that I get to serve. The only difference between me and them is they used more and they used longer. And I was simply fortunate enough to move away from substances before they became a problem for me. I say that with the caveat of it's amazing to me that I'm addicted to two substances. I'm addicted to caffeine and nicotine, but I live in a culture that says I'm not a drug addict. I think one of the most important things we can do is talk within our families about substance use disorder, and most of all, talk to your children. There's a story that I tell occasionally. Many years ago, I had written some articles for my local newspaper, and I was in a bagel shop early one morning. A particularly cynical gentleman was standing in front of me and recognized me from pieces that I'd had published about addiction recovery. And he very cynically asked me, so, okay, what do you think the solution to addiction is? And I was thinking, man, it's early on a Sunday morning and I just want to get my bagels and go home. So without even thinking, what I said to him was, invest in every child that you meet. In terms of preventative measures, in terms of all the things that predispose people like me to using substances to cope, the lack of connection, the lack of basic life need fulfillment, living with abuse and neglect in our childhoods, experiencing trauma, these are the greatest risk factors. Certainly, having a genetic predisposition to addiction is an important consideration as well, but that's not something that we can act on locally. Investing in children in our community is. I urge everyone who's the least bit interested to watch Johann Hari's TED Talk entitled Everything You Know About Addiction is Wrong. Johann Hari is a journalist, and he spent 2 years of his life traveling all over the world, talking with different cultures and asking the same questions. What is your understanding of addiction? What causes it? What lends to it? And the common theme that he found was that every culture had some degree of conceptualizing addiction as disconnection. Disconnection from self, from family, from community, and beyond. Disconnection is inherently painful. It's intolerably lonely. And too many of us feel apart from, yearning to be a part of. So particularly when we have the opportunity to help children get their basic life needs met, help them to develop greater self-worth and self-efficacy, then we do meaningful things to help people move away from the possibility of developing substance use disorder. Gotta check the streams real quick. Again, would love to hear about your questions and comments. What's going on with you and what kind of thoughts do you have on this topic? Okay, so far folks are quiet, but always welcome that connection. Let's see. I think, one of the most glaring deficits in our attempts to shift the trajectory of addiction is a real lack of substantial efforts in education and prevention. To this day, in almost every state, we do not have a mandated curriculum, nor do we have a federally mandated curriculum. We leave it to local school systems to determine what it is that will be presented to kids and how much of that will be discussed and how it will be discussed. COVID has certainly underscored the burdens that we put on educators, and I think that's just the veritable tip of the iceberg. I got to serve on local and regional school boards for a number of years, and I noticed in all the time that I served that we kept adding and adding and adding work and responsibilities for educators, but we never seemed to take anything away. Public schools are the default safety net for kids, and they're under-resourced, they're underfunded, and it's just a mess. So continuing to look to public schools to provide children so much of what they need obviously isn't working. The opposite extreme of demanding that families provide everything that children need obviously isn't working. It hasn't worked for many decades now. And so we, again, come back to substance use disorder as a community responsibility, and we look for opportunities to work within our neighborhoods and within our community to provide for the basic life needs, not of children, but of families in general. There's a number of things that yield objectively healthier outcomes, and some of those are very simple things. When people are able to attain stability, we see better outcomes in addiction, meaningful employment, when they're able to get job training or some education that's going to prepare them for a better career, we see better outcomes. And then, frankly, there's an awful lot of things that I think we don't think about and don't talk about because it's a product of our privilege. So food insecurity is a pretty major issue. When people don't have their very basic life needs met, it's exponentially harder to make gains in every part of your life. And that's very simple to understand. I think, unfortunately, it's altogether too easy to overlook. So my hope is that we will invest in many different ways in providing education, that we not simply preach abstinence. My observation is that whether it's through public schools, through churches, through community centers, the approach that we take to substance use disorder is actually disturbingly similar to the approach that we take with sex education with kids, which is that we simply preach abstinence, don't do it, it's bad, and we don't even give them facts. We don't give them thorough information. And ideally, one of the many things that we'd be doing with kids and adolescents is helping them to understand what is it that's happening in their own families. Ideally, we'd be supporting children whose parents are incarcerated. Ideally, we'd be looking at how do we organizationally and as a community respond when children's life needs are not being met by their families, and again, treating that as a community responsibility. I think there's so many opportunities for us to examine our own lives and to move away from the us-them dichotomy. I often encourage people to consider how much alcohol is a part of their life, how much it's steeped in our traditions and in the ways in which we socialize. It's incredible to me how often I'm asked why I don't drink. And the question is inherently misguided. I think we've progressively become a culture that is increasingly resistant to looking at ourselves and exploring our personal responsibilities. The answer that I give as to why I don't drink is because I have an incredibly addictive personality, and alcohol is one more thing that I know I won't do in moderation, and so I choose to abstain. Now, I'm very blessed and fortunate because if I were someone who lived with substance use disorder, I would experience the compulsions and the obsession and the demand from my brain that alcohol is something I needed. Instead, I have a body that can't tolerate alcohol. And it took me a long time to come to terms with that. But professionally, as soon as I started serving people in recovery from alcoholism and recovery from drug addiction, again, I couldn't find a single point of separation between them and myself. The only meaningful difference was they used more, they used longer, it created greater problems. And it was maybe the first time in my life that I stepped back and said, okay, this is a problem waiting to happen, so let's not let it come to fruition. With most things, I think we take the opposite approach. We wait until we can't stand it anymore to make changes. We wait until, as my friends in recovery say, the fear of change gets outweighed by the fear of staying the same. So much of what we do, whether we are neurotypical people, people with substance use disorder, or people like myself who live with mental illness, so much of what we do is designed to maintain status quo. Most people are opposed to change, and so unwittingly we work and endeavor in such a way that keeps things the way that they are. Whether the way they are is healthy or not, whether they're satisfying or not. And I think it's high time to examine those. What we've just come through in the past 16, 18 months has been extraordinary. And I think a lot of us are living with the fear now of what's the next piece that follows in COVID. How is it that social isolation has affected us and may affect us again in the future? So I think it's a great time to simply take stock of ourselves, take stock of our family, and to consider not just what it is that we want and what it is that we feel, but also what are the needs that aren't being met individually, within the family system, and within your local community. And how can we move in such a way to fulfill those needs? Because it is a responsibility. It's vitally important. And it's something that I think all of us need to weigh and find practical applications. There's a million ways to do that. If you have something in your community that supports recovery, contact that person and just ask how it is that you can be supportive. Get trained in carrying and administering Narcan. This is a huge piece that can normalize and reduce stigma. So ideally, getting trained in how to save lives through administering Narcan would become as common as people getting trained for CPR or basic first aid. We do those things, I think, most often because our jobs or something about our lives requires that we do it. But those are life-saving measures, right? And so potentially we could look at everything that we do to reduce the impact of substance use disorder as a life-saving measure and something that is inherently valuable, inherently of service to our communities. So, going to be wrapping up shortly for today. Would love to connect with you. Lots of ways we can do that. Again, head over to Sober Now's Facebook page, give it a quick like. You'll get notifications for our next live stream and for other content. Head over to YouTube and look up Sober Now's YouTube channel. Over 160 videos there on various aspects of recovery, from mental illness, from self-harm, eating disorders, and from substance use disorder, all of them completely free. And then a super low cost and effective measure that you can check out, sobernow.com. We recently moved to a subscription monthly service at under $15 a month, and that gets you access to 2 of our 28-day programs. Home study, completely confidential, guaranteed anonymity, and the opportunity to fortify your recovery, whether that's from substance use disorder or whether you're somebody like me who identifies as an affected other. Affected others are those of us who have loved ones in active addiction or perhaps early recovery, looking at how addiction impacts the family, not just the person that's using. There's so many unintentional, unwitting consequences that we incur, oftentimes without even realizing it. So check out those resources and connect with me. Jim@sobernow.com is the easiest way to connect with me. Would love to hear questions that you have. Would love to hear topics that you'd like to see covered in future live streams. Please take good care of you and each other. Please connect with me, and I'll look forward to talking to you next week.